Wellness Wednesday with Dr. Bradley Meyer from the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave. Good morning, everybody out there listening.
Yeah, absolutely. So today we're going to talk about some folks you've been working with, autoimmune issues and rheumatoid arthritis.
Absolutely. You know, I love to focus on pain because when we're working to activate these healing systems, we're able to work in a big way to reduce that pain significantly. And it's sometimes things come into the clinic in pairs or triplets, it seems. And right now we've got, I think, 3 cases of folks that have had pretty disabling rheumatoid arthritis over the course of their lifetime. They've been through a lot of prescription medications with varied success. Some of them, they've been through multiple, and those things weren't working very well for them anymore. So they came into the clinic looking for other options, and that's the path we started with them. They again, just a reminder of what rheumatoid arthritis is, or autoimmune conditions. It's essentially where the body starts to lose the sense of what is self and friend versus foe. So we want our immune systems to go after things that are hard on our body or not good for our body, such as viruses or bacteria or any kind of toxin. But sometimes that immune system, due to a multitude of reasons, gets confused in our lifetime, and it starts to actually attack our own self, our own body tissue. And in the case of rheumatoid arthritis, that can be felt in the form of stiffness. It can be felt in the form of joint pain. It can impact so much from a physical perspective. It can affect mobility, and of course then sleep, because if you're in so much pain, it affects that. So you have this cascade of effects that just over time really can take a toll on the human system. And so just like anybody that comes in here, we're looking to peel back the layers of that onion, utilize some of these tools that we have to activate these healing systems. And so there's a lot of different beliefs out there on, well, what exactly is an autoimmune condition? Is there an underlying infection involved in it, such as like an underlying virus that's never gone away? Underlying bacteria, is it because of a toxic food source, something along the lines that got this ball rolling and triggered? Most of the time folks that have an autoimmune condition also have an associated problem in their digestive tract, and we call that the leaky gut. So many times we're always looking to go back, the team here, to look at the digestion and work to figure what is causing distress in the gut. And once we work in that area, then we start to work and try to find other biologic systems throughout the body that are out of balance. So everything should work in harmony. And a lot of times in a traditional setting in which I was trained, we start to focus in on one system. Whereas right now I'm looking at how all the systems interact together again, whether it's the hormones or it's how well do you detox through the liver, how well do you activate or internally mitochondrial molecularly make energy? Do we make it as well, ATP as well as we should? How well do all these systems play together? And what we will have folks do, it's a unique approach to integrative medicine or functional medicine, different than the traditional world, the lab work. And when folks come in for lab work, many times folks they'll say, I don't feel well. They'll go to their doctor, and this has changed for me, and my blood work is within the normal range. And so that can be quite frustrating for folks because they don't feel as well as they did 5, 10, 20 years ago. And the blood work, and we have to remember the blood work that we look at has parameters that are set for a very wide range. So it encompasses a lot of not optimal blood result ranges. And so for folks that come in to see us, we're looking at trends in that blood work. We're looking at which which blood tests are indicating which organ system or terrain is a little out of balance, which ones need our focus first. And so many times, again, in the case of autoimmune, we're focusing on inflammation, and we're focusing on the liver and the detox, and we're focusing on oxygen, molecular activation internally. How well do you make energy? If we find out, come in, do these labs, we have a certified functional lab individual team member that's fantastic, Molly Avery, and she will review those labs alongside me, and we'll pick out and determine which systems are out of balance. And a couple of cases, these 2 to 3 cases, actually it is 3 that have come here, Dave, they have been absolutely, the one she had weakness in her lower legs, and she was still dependent on prednisone, which is a steroid, and she could not get through the day without taking a nap and needing to take a rest. And the pain and weakness was, again, disabling. So we got her going on a molecular activation protocol where we're really focusing on her adrenals. Big place that I focus. The adrenals is the anti-stress hormone. And then we focus on any other toxins in the body. Of course, always cleaning up the diet, the nutrition, because that can have such an impact on inflammation. Those are big ones. And then the third piece is molecular activation with supercharged oxygen. That's ozone therapy, hyperbaric therapy. And when we get folks going on these combinations of things, in her case, I was able to help her wean off of prednisone, and we supported her adrenal gland at the same time. And now she's back to teaching. There was some question whether or not she was going to be able to do that when she came into the clinic 2 to 3 months ago, and she is on her way to a very good path in which she's going to be able to have some quality, be able to, again, teach and not be dog-tired.
That's awesome. So hone in just a little bit. You mentioned you focused on the adrenal. How do you do that?
Yeah, the adrenal glands, that's, again, the anti-stress hormone. Many of us, it's living life in the fast lane, and I check a blood test it's a morning lab, and we're looking to see how much signal is coming from the brain. And when we check that lab, if there is a huge signal coming from the brain, it means that the body's not making enough of the adrenal hormone. And because it needs more and more signal. So the higher that number, the more likely that adrenal support is needed. And there's different ways to go about that. That can be a pharmaceutical prescription, and it also can be through more of an integrative, holistic, functional support mechanism where we're looking at doing supplements and getting rid of as many toxins in the body to rejuvenate that adrenal gland. But it's a really gratifying treatment, because when I do focus on the adrenals, many times folks are noticing an improvement in their brain fog, chronic fatigue, afternoon fatigue within 3 to 5 days of starting the treatment. And so that's the case with these folks that I've implemented that protocol with them, along with the IV ozone. And I do hope to get them on the air as we move forward, because several of them have just had life-changing turnarounds. They were headed in a direction that was not much hope, a lot of worsening pain and spinning in the wheels. And by the time we've gotten into the protocols and they've committed to working on dietary changes and such, it may be 1 to 2 months in, but wow, it is fun to see the transition folks make when their body starts to flip from being on the defense and then turning to being on we've got enough energy now. We're going to go start to fix things. We're going to start to reduce inflammation in the body, and we're going to start to play catch up. And when you see folks coming in just moving better, moving more efficiently, their gait more stable as they walk through Okoboji Wellness Clinic, those changes from week to week have been quite evident with these folks that have come in with their rheumatoid arthritis.
That's so cool because that pain has just got to be debilitating at times. All right, Dr. Meyer, for those that want to come see you or visit with you, what's the best way to make that happen for folks who are just wanting to live the day, not just survive the day?
Yes, so we've got a great team here, a bunch of talented folks, so come see us, get your journey started, and we are here to assist. So we are just off Highway 71 in Spirit Lake. We're at 3305 Berquist Avenue, and our phone number is 712-339-6024. You can call us to set up a discovery call if you'd like. That's 15 minutes complimentary, where I discuss a little bit of your history and making sure we're a good fit, and the time is right and ready for you to start that process moving forward. But we get the ball rolling, talk about a little bit of the details of what it's like to go through the process and the protocols, but it is an individual experience for everybody. That's what we work on to make this place feel like home, and identify a path that is best for you. And what I've found is, yes, there are patterns and there's protocols, but everybody's unique. So we want to find what is the best specifically for you so you can thrive every day.
Absolutely. Dr. Meyer, always a great pleasure. Thank you so much. Have a wonderful day, and we'll chat again soon.
Thanks, Dave.
Thank you, Dr. Meyer. Dr. Bradley Meyer at the Okoboji Wellness Clinic. You can find out more online, okobojiwellnessclinic.com.